Good day, Doc. We're going to discuss the history of epidemiology. What is epidemiology? It is the study of the distribution and determinants of disease or health status in a population. The Greek physician Hippocrates is known as the father of medicine and was the first epidemiologist. He hypothesized that disease might be associated with the physical environment, including seasonal variation in illness. Described by Merriam-Webster as medical science that deals with the incidence, distribution, and control of disease in a population. Epidemiology's origins are largely credited to legendary Victorian doctor John Snow. His claim to fame in discovering that cholera is spread by a parasite through contaminated water or food. Snow's work even earned the nickname the father of epidemiology. Snow's cholera discovery began in late 1848, when a deadly outbreak of Asian cholera struck London. At the time, the prevailing miasma theory was that cholera was spreading by rising poisonous gases and decaying particles, but John Snow was highly skeptical of this theory. In the first edition of On the Mode of Communication of Cholera, published in 1894, Snow extended arguments he had long held, that cholera is a specific disease spread by water contaminated by feces. Many Londoners received their water from hand pump wells that were located throughout the city. Increasing numbers of businesses and homes had water piped from the Thames River by private companies. Snow learned that municipal records that two private companies supplied piped-in water to the areas that were primarily affected by cholera. Some consumers were supplied by the Lambeth Company, while others were supplied by Southwark and Vauxhall. The map of London below shows the areas of London supplied by these two water companies. In late August of 1853, cholera broke out in the Broad Street area, and the residents panicked and many began to flee. A hand pump was located right on Broad Street, and Snow was immediately suspicious. Water samples did not reveal gross contamination, but Snow persisted and began to collect detailed information on where the victims had gotten their drinking water. He obtained the names and the addresses of the first 83 victims who had died by the end of the first week. He went to their homes and learned from relatives that the vast majority of them had obtained their water from the Broad Street pump. As shown here, deaths from cholera in districts of London supplied by two water companies from 8th of July to 26th of August in 1854. The water supply company, Southwark, and the population in 1851 was 167,654, with deaths by cholera of 844. Cholera death rate per 1,000 population was 5.0. In contrast, Lambeth, with a population of 19,133, had 18 cholera deaths, and a cholera death rate per 1,000 population of 0.9. In retrospect, Snow made several important contributions to the development of epidemiologic thinking. He proposed a new hypothesis for how cholera was transmitted. He tested this hypothesis systematically by making comparisons between groups of people. He provided evidence for an association between drinking from the Broad Street well and getting cholera. He argued for an intervention which prevented additional cases and the removal of the pump handle. And moving on from John Snow, and not that John Snow, but this John Snow, evolved to more developments in epidemiology, in which Richard Dahl and Andrew Hill studied the relationship between tobacco use and lung cancer in the beginning of 1950s. It was the first time that they used a quantitative method to study diseases in human population. And with the developments in epidemiology, it has now become important in all countries with the rise of new communicable diseases such as SARS. Epidemiology has evolved considerably over the past 50 years, and the major challenge now is to explore and act upon the social determinants of health and disease, most of which lie outside the health sector. Thank you, and that